Now let's move on to the posterior compartment. The posterior compartment has two muscles. So whenever we think about the posterior compartment, only one muscle comes to our mind, and you are correct if it comes like that, because the other muscle is very insignificant. It has a very minor role, but regardless, we will study that later as we'll go along. So the first and the most major muscle that is present in the posterior compartment, that is the triceps brachii. So as the name states, it's called triceps. It means that it has three originations. So again, this is our scapula, this is the costal region, and this is the posterior region. This is the glenoid cavity. So we discussed that the supraglenoid tubercle has the origination of the long head of the bicep. So the infraglenoid tubercle, which is inferior to it, it has the origination of the long head of the tricep muscle. So you can see that this is the scapula on the picture. This is the scapula, and there's an origin of the tricep muscle. And you can see this is the glenoid cavity, and just over here there's the origination of the tricep. So this must be the infraglenoid tubercle. So we are done with one origin. We have to talk about the rest of the two. The rest of the two are called the medial head of the tricep muscle and the lateral head of the tricep muscle. So they are arranged in a way that we'll go back to our humerus. So this is the anterior aspect of the humerus, and this is the anterior aspect of the humerus, and this is the posterior aspect of the humerus. And you can see that there is a radial groove which is going downwards. There is a radial groove which is going downwards. So the rest of the two heads of the triceps are arranged according to the position of the radial groove. So the medial groove, the medial head of the tricep muscle is on the inferior aspect of the radial groove, and the superior aspect and the lateral aspect of the tricep muscle is on the superior aspect of the radial groove. I'll repeat it again. So the medial head of the tricep muscle is on the inferior, it's inferior to the radial groove, and the lateral aspect of the lateral head of the tricep muscles is on the superior aspect of the radial groove. So what does the our tricep muscle do? So the bicep, the anterior compartment muscles were flexing our elbow joint. So the tricep muscle actually extends our forearm at the elbow joint. I hope this makes sense. So one thing that is really important whenever you study about the upper limb, that is all the muscles of the posterior side of the upper limb, either it's in the arm or it's in the forearm or it's in the wrist. They are all supplied by a singular nerve, that is radial nerve. So it's really easy to remember the innervation of the muscles of the posterior aspect of the upper limb. That is all being supplied, whether it's in the arm, it's forearm or wrist, they are all supplied by radial nerve. As opposed to in the anterior compartment, in the arm we have musculocutaneous nerve, in the forearm we have medial nerve and ulnar nerve and all of that thing. Okay, so we have done the function extension and it's innervated by the radial nerve, and we have already discussed C5, C6, pick up the sticks. So it's the flexion of the forearm, and C7, C8, lay them straight. So it's the extension of the forearm at elbow joint. The second muscle which I was talking about, which doesn't play a very significant role, is the Anconeus muscle. So this is the ulna. I can see the olecranon process, and this is the radius. This is the medial side of the upper limb, and this is the lateral side of the upper limb. So this must be the medial epicondyle, and this must be the lateral epicondyle. So the origin of Anconeus is actually coming from the lateral epicondyle, and it inserts at the olecranon process of the ulna. And you can imagine when it will contract, it will also extend the forearm. It will also extend the forearm. But is it a very powerful extensor of the forearm? No. The most powerful extensor at the forearm is the tricep muscle, but it actually exists in tricep in extending the forearm. Okay, that's all that you need to know about the muscle Anconeus. So what's happening over here? So if you thought this is the fracture of the shaft of the humerus, you're right. So the question is which structures are damaged and how it will manifest. So before we go forward, the thing which you need to know about fractures of any bone. So whenever a bone breaks, so its fragments, as you can see, they are displaced either anteriorly or posteriorly. The thing about these fragments is that these are razor sharp fragments. So there are some structures which are present all around the bones. There can be a nerve, it can be a vascular structure, it can be muscles. So depending on the movement displacement of the fractured fragment, it can damage structures all around it. That is why whenever you suspect fracture of any bone in someone, you have to really immobilize that structure using a splint or other techniques, so that when lifting the patient up, you don't accidentally traverse or transect the neurovascular structures which are accompanied all around the bones. Okay, So when the shaft of the humerus breaks, when the shaft of the humerus fractures, posteriorly, we read that posteriorly there was a radial groove which was going downwards. There was a radial groove that was going downwards. And why is it called the radial groove? Because the radial nerve actually goes along with it. So if there's fracture of the shaft of the humerus, you can actually damage the radial nerve. There's an artery which is also accompanied with the radial groove, with the radial nerve, that is called the profunda brachii artery, and that actually supplies the muscles of the posterior compartment of the arm. So how will it manifest? So I said, so we have established that if there's a fracture of the shaft of the humerus, the radial nerve is prone to get damaged. So how will it manifest? So I said that the radial nerve supplies the innervation to all the muscles on the posterior aspect of the upper limb. So that means it will cause extension at the elbow, and it will, if this is flexion at wrist, so it will also cause extension of the wrist. So it's causing flexion, extension of the elbow, and flexion, extension at the wrist. Okay. So if the radial nerve is damaged, so you can imagine that the extensors will be lost. Extensor of the wrist will be lost. So there will be unopposed flexion of the wrist. There will be unopposed flexion of the wrist. So if I'll see it like this was extension and this was flexion. So if there is unopposed flexion, so we call this state as that the wrist has dropped. This is called dropped wrist drop. Okay. So the question becomes that, sir, why isn't the extension of the elbow getting affected? The answer to that is the branch of the radial nerve that supplies the tricep nerve actually emerges proximally to the shaft of the humerus. It basically emerges proximally to the radial groove which is present on the shaft of the humerus. That is why usually in the shaft fractures, that branch of radial nerve which supplies the tricep muscle, that is not damaged. That is why we have intact extension at the elbow joint. So this is how it will manifest. This is called the wrist drop. And what is the blood supply to the posterior compartment muscles in the arm? That is being done by the profunda brachii artery. And with that, we are done with the posterior compartment of the arm.